Welcome all to 6th episode of Assimilate Fireside Chat by Medvarsity with Dr. Jatin Yegurla, consultant gastroenterologist at Apollo Hospitals. Today's episode will bring you latest updates and expert opinions on recent advancements and treatment options on irritable bowel syndrome. I'm Dr. Lavanya, your host for today's session. So we welcome you, Dr. Jatin, sir.
Thank you.
So, sir, before we deep dive into today's discussion, why you have chosen the specific topic for this discussion?
So, with the change in the dietary habits and fast-paced life that we are leading, and more urbanization, the incidence and of irritable bowel syndrome has grown manifold, and there's been a lot of surge in the recent past. And unfortunately, many are not having a lot of awareness about this disease. Most of the primary care physicians are not able to diagnose this. Because of the delay in the diagnosis, there is a lot of quality of life that is affected, and that's why I think it's important that we raise awareness about this very important and prevalent condition, that is IBS.
Thank you for sharing those insights with us, sir. I'm sure we'll deep dive into a discussion today. So, further moving on, what are the latest medications available for IBS management?
So, IBS, we'll have to divide the medications that are available into 3 different categories. So, we have the pain control medications. So, the analgesics that we use in IBS are quite different from the others. So, here we have anticholinergic medications like dicyclomine and chlordiazepoxide and pinavarium bromide. And these are the common antispasmodic medications that we use especially for pain control in IBS. So, apart from these, we usually use them in a combinations and depending on the response of the patients. So, apart from this, for diarrhea predominant patients, we use medications like rifaximin, which mainly targets the SIBO component, that is the small intestinal bacterial overgrowth, which is seen significantly in patients with diarrhea predominant IBS. And probiotics are also an important medication that are used in diarrhea predominant IBS. When we come to constipation, management of constipation in IBS, the dietary fiber supplementation is the first line treatment. Apart from that, we have some very good medications that we can divide them into osmotic laxatives or bulk forming laxatives, and there are also stimulant laxatives. So, stimulant laxatives, we have sodium picosulfate, and for osmotic laxatives, we have lactulose. Bulk forming agents are psyllium husk or isabgol, and these are the medications. There are some newer medications for constipation predominant IBS, which are like procalopride, which basically increases the motility of the entire intestine, and it will be helpful for patients who have overlap with gastroparesis. You don't have to give a couple of motility agents for both the conditions. The procalopride will take care of both the increasing the colonic motility as well as the gastric motility. Apart from that, we have cyclic GMP modulators and plecatide. So, that is not available currently, but they're soon to be launched in India as well. So, overall, these are the medications or the pharmacotherapy of a landscape of IBS, but management of IBS, pharmacotherapy forms only 25% of the treatment plan.
Thank you for sharing those insights, sir. So, as you mentioned about probiotics now, so can you tell us in brief about what the role of the probiotics and gut microbiota in the treatment of IBS?
Yes. So, we have billions and billions of species of microbiota within our intestinal tract, starting right from the mouth till the anal canal, and this bacteria, where there is growing body of evidence that this bacteria is responsible for many of our metabolic functioning, and alterations in these are actually responsible for many of the conditions, right from gastrointestinal diseases even till neurological conditions. So, it's very important, and our understanding is constantly changing. And important thing about probiotics, before we discuss about the probiotics, the diversity of the gut microbiota is very important. So, we need to maintain a very rich diversity, and for that our diet, our childhood dietary habits, our lifestyle habits play an important role in shaping the microbiota. if in case somebody has a poor diversity or they have dysbiosis, which means that there is reduction in the harmful bacteria and a reduction in good bacteria and increase in harmful bacteria. So in these conditions we try to modulate the dietary fibers by giving certain strains of probiotics, and or we give some fiber supplements to increase the diversity. So usually the probiotics that we prescribe in patients with IBS are the ones which are good for our gut, that are lactobacillus or Saccharobacillus boulardii or bifidobacterium. So these are the usual, but nowadays we have some probiotic combinations which have multiple strains of multiple genera, and so just taking probiotics may not be sufficient, and increasing your dietary fiber increases the diversity of your flora. So if you want to increase your gut microbiome diversity, take a lot of fiber content, and that's about probiotics.
Thank you, sir. A bit more to add on this. As you mentioned about probiotics, is it safer to take probiotics on a regular basis without any common known syndromes or symptoms?
So it is not studied, but usually in a medical conditions or in IBS or anything, we give them for a short course of therapy from varying from 2 to 6 weeks. But they never recommended or studied about the long-term effects of taking the probiotics on a regular basis. And however, they usually are not associated with any harm. But recently we have fecal microbiota transplantation. So what we do is we collect fecal samples from healthy donors after we screen them for all the possible diseases, and we transplant them into the recipient. And this has become established as a refractory cases of Clostridium difficile infections or recurrent C. difficile infections, and in certain other conditions like severe alcoholic hepatitis or inflammatory bowel disease. And even in IBS, there is now some research suggesting FMT is useful. So something that we learned from FMT is that we had few patients who died of E. coli septicemia after having fecal microbiota transplantation. So our understanding about long-term benefits of probiotics or fecal microbiota transplantation is very poor. However, we suggest that the duration should be restricted to usually around 8 weeks.
Thank you for sharing those great insights with us, sir. Well, further move on to the next question. As you mentioned about FMT, and also like, are there any new physiological therapies which can be directly targeted for the IBS treatment?
Yes. So whenever we have a patient with IBS, just writing them the prescription of medications is never sufficient. These are going to control the symptoms as long as they are on the medication. So establishing a good rapport with the patient is very important, and trying to explain them what is the root cause. So the root cause is mostly because of visceral hypersensitivity. So that is the disorder of gut-brain interaction, and in order to target it in a more natural and consistent manner, we'll have to provide more than medication. We'll have to counsel them, we'll have to extract history regarding whether they are having any mood fluctuations, whether they have any anxiety, depressive symptoms, how is their sleep. So if you identify that they have any significant psychosocial comorbidity, then you need to address them, not just by counseling or just a few antidepressant medication, but by providing them certain psychotherapies. For example, cognitive behavioral therapy or gut directed hypnotherapy, or mindfulness or relaxation exercises. All these things will definitely have an impact, and now we have very good evidence that just the gut directed hypnotherapy or CBT alone can cause significant relief in symptoms and improves the quality of life. So we should always take good history and direct them towards the psychiatrist or your psychologist counterpart, so that they'll take care of that.
Thank you for sharing, sir. Furthermore, to add on this, as you mentioned about the sleep and diet pattern, so what are the specific indications for the diet or sleep pattern for the people suffering from IBS syndrome?
Yes. So if you look at patients with IBS, whenever they are stressed or they have mood fluctuations, they have some depressive symptoms, their sleep is significantly disturbed, and sleep is something that which we is very underestimated. A good sleep is very important for recovery for neurons, and this is affected. So whenever we don't just give them medications to increase sleep like Alprax or Restil, these are not the solution. We'll have to tell them to reduce the screen time, have a hot shower in the evening, and have a walk in the evening. These will definitely improve their sleep cycle. Secondly, we can give them some medications like zolpidem, which are non-addictive, and if still the sleep is not improved, then we can give them neuromodulators like amitriptyline tricyclic antidepressants or escitalopram. Usually, so I have not discussed about the neuromodulators, so that we'll discuss later. So that is about the sleep. And second question about the diet, if you ask me. So we all know that low FODMAP diet is something that is very important. So what is FODMAP? Basically, these are fermentable oligosaccharides, disaccharides, and polyols. So whenever these are short chain, whenever these are digested in the intestine, these small chain carbohydrates which are digested in the intestine leads to a lot of gas production, and this leads to bloating and other pain and other symptoms in IBS. So we try to reduce the intake of these high FODMAP diet, and thereby reducing the symptoms. So whenever we advise somebody low FODMAP diet, previously we used to ask them to strictly eliminate all the diet that have a high FODMAP. If you want me to list out, so some examples of the food that IBS people have to avoid are certain fruits like apple, pear, watermelon. These are having high FODMAP, and we ask them to reduce the intake of these, and we ask them to take more of berries like blueberries, strawberries, and so these are the fruits. Vegetables, we ask them to reduce the intake of garlic, onion, cauliflower. So, and instead we encourage them to take a lot of spinach, green leafy vegetables, tomato, and etc. Coming to dairy products, definitely gluten and dairy. We know that these exacerbate a lot of IBS symptoms. So, apart barring yogurt, we ask them to reduce a lot of dairy products and wheat containing products, anything like pasta, cereals, or maida containing foods. All these have to be restricted. And in low FODMAP alternatives, rice, quinoa, and oats are very good. So we usually recommend people to have recipes including these things. And coming to fiber, there are two categories basically, whether it is a soluble fiber or insoluble fiber. If somebody is having diarrhea predominant IBS, then it's better to take soluble fiber like oats and barley. And if the patient is having constipation, better to take insoluble fiber like whole grains, nuts, and dry fruits. So overall, this is the general advice that we give about FODMAP diet in patients with IBS. However, previously we used to advise strict elimination for first 6 weeks and then reintroduce the one by one and see whether the patient had response to the initial abstinence and the reintroduction. If they identify that anything is causing trigger, we ask them to avoid it. But now we have relaxed this criteria, and we are asking patients to maintain a food diary and ask them to correlate which food that they had in the diet has caused their symptoms. And this way we are able to identify the dietary food triggers and able to give them personalized recommendations.
Thank you so much, sir, for sharing all the insights with us. We have one last question for today's session. Can you also explain the importance of a telemedicine and consultations in such IBS symptoms patients?
Yes. So the biggest hurdle in management of IBS is that it's going to stay with you for a long time. So whenever patients are not able to accept this fact and they expect that we treat them only for few months and then their disease has to be completely cured. But it's very important to explain the patient about this, and in order for the patient to have consistent follow-up and to identify what are the things that are working for him, they need to be very compliant with the medication. To increase the compliance and to provide them to bridge the gap, basically what is the gap is patients have a lot of stigma when we ask them to meet a psychiatrist to treat their depressive symptoms or anxiety, and dietitians or the ones trained dietitians who are experts in counseling for IBS specific recommendations, they are not available everywhere. So a couple of years back there was a very big study in Lancet Mantra trial, which is very famous, that has shown that integrative care, that means whenever a patient comes, a psychologist, a trained psychologist, trained nutritionist and a gastroenterologist together, providing them each of their recommendations, have significantly improved outcomes when compared to just treatment by the gastroenterologist. So to bridge the gap of this, now I think we have some applications or websites that are providing these dietitian and psychotherapy counseling sessions on a weekly basis for a subscription. For example, our biggest pharmaceutical, Dr. Reddy's, has launched Daily Bloom, and that is doing a good outcome. And another application, HeloGut, is also showing promising results. And we at Apollo are also recruiting a lot of patients, and we have seen good results. And because at the comfort of the patient's home, they're able to access these sessions. So it's very important. And it's important that these neuromodulators, for example, in constipation predominant IBS, we give Nexito or escitalopram, and diarrhea predominant, we give amitriptyline or tricyclic antidepressants. So it's also important to counsel them to keep them on a long-term basis and not stop them abruptly, and also teach them what are the triggers, what are the coping mechanisms, and what are the rescue options that they should have. So integrative care is the way forward, and it is going to change the management of IBS.
Oh, thank you so much, sir, for taking your time out for sharing such a wonderful insights with us today on most important topic, and it also people neglect it most of the times. Correct. On irritable bowel syndrome. Thank you, sir.
Thank you.